does everyone understand a little bit of Marathi? जर नाही कळलं तर मला सांगा. पण आत्ताचा जो सेशन आहे आणि तो थँक्स टू केतकी, मी मगाशी मला इंट्रोडक्शन करताना ती जे काही म्हणली त्यांनी खूप खुश झालं, कारण ती म्हणली हा सेशन अकॅडमिक नाही आहे. येस, दॅट्स व्हॉट आय वॉन्टेड ऑन अ संडे मॉर्निंग. So I'm not going to do this as an academic session. It's mainly a discussion between me and my friend and colleague Smita. And in this session, what we are hoping to do is to figure out what me as a psychiatrist and the psychiatry community and Smita as a clinical psychologist, what we do towards mental health and the challenges that we face, the backgrounds that we come from, what we expect from other colleagues, the colleagues who work in mental health, and what other colleagues and also आपण काही म्हणू, पेशंट म्हणू, क्लायंट म्हणू, पर्सन म्हणू, what they expect from us. So आत्ता आपण नातू मॅडमचं जे लेक्चर ऐकलं त्याच्यात एक शब्द वारंवार येत होता, that was mental health. So the question that comes to mind is, what is mental health? And sorry, before I go any further, साधारण 30 मिनिटं मी बोलायचं असं ठरवलंय, मी आणि स्मितानी मिळून, आणि नंतर क्वेश्चन आन्सर्स. What I would love is, if there are any questions, don't wait for 30 minutes. Just stand up, ask your question. I want it to be more like a discussion. So the point I was getting at is, what is mental health? Any ideas? Because, yes ma'am. I think we are all audible, so.
Yeah.
So it's basically a journey from distress to well-being. That is my one of
True.
the
Okay. Anyone else? Perfect. Because you are also right, but what usually happens is when we talk of health, health is often seen as absence of disease. Doesn't have to be so. Even with a little bit of disease or disorder, we are still healthy, right? मला गेले 2 आठवडे सर्दी झाली आहे, म्हणजे मला काहीतरी व्हायरल इन्फेक्शन आहे, पण तरीही I think I'm healthy. So even with a disorder or a disease, and I'll come to the mental disorders and diseases, you can still be healthy. So it's a state of well-being, and it's not me who is saying it. Well, I say it too, but it's the WHO who says that mental health is a state of well-being. So the next question that obviously comes is, what is mental well-being? Again, open to everyone.
Yes.
काही ideas,
So
Smita?
mental well-being म्हणजे माणूस काही एकटा नसतो. He has emotion, he has social system, he has family system. That well-being is all about ki what my family says, what my emotion at present, what support I have. म्हणजे नातू मॅडमनी मगाशी खूप छान प्रेझेंटेशन केलं. इन दॅट प्रेझेंटेशन वी अंडरस्टँड ॲज अ ह्युमन वी हॅव सो मेनी थिंग्स फ्रॉम चाइल्डहुड. वी हॅव दॅट पर्सनॅलिटी फॉर्म. So that well-being means the collaboration of all emotional, family, social support, and the spirituality you belongs to. She talked about the interdisciplinary. So I guess sir is also agree that spirituality also contribute more in your personality. So everything contribute as a well-being.
And going beyond that, I think when do we say that a person is healthy or his mental health is good? Again, there are certain parameters that have been set by wise people in the field. And what is mental health is when an individual is able to realize their own abilities. मी काय करू शकतो, cope with normal day-to-day stresses and the challenges. Also, someone who is able to work productively and contribute to the society that we live in. So again, going back to where I started, is nowhere in here it says that somebody who is mentally healthy means somebody who doesn't have depression or schizophrenia or anxiety or stress. Because for us to have this well-being, and these 4 points that we just saw, realizing your abilities, coping with stresses, working productively, and making contribution to the community, all of them are anxiety provoking. All of them are going to produce some stress. Does that mean we are mentally unhealthy? No, we are not. If you are able to deal with all those in your own ways, that is fine. Because it's often said that it's okay to be not okay most of the time. So the problem comes when things go beyond control, when they spiral into a state of mind where you are not able to fulfill these 4 things. And that's when one becomes in need of some mental health support.
Yes, correct.
So again, mental health म्हणजे काय हे आपण एकदा डिफाईन केलं की ॲज प्रोफेशनल्स आपले रोल्स काय आहेत. सो व्हॉट डू यू थिंक ॲज अ सायकॉलॉजिस्ट अँड वेल ॲज अ सायकॅट्रिस्ट, व्हॉट डू यू थिंक वी डू?
We do, as a normal population, I ask की किती लोकांना वाटते की आपण सायकॉलॉजिस्टला किंवा सायकॅट्रिस्टला भेटायला पाहिजे. म्हणजे मला ताप आलं तर मी लगेच डॉक्टरांकडे जाते. आय सी द फिजिशियन. मला फ्रॅक्चर झालं तर आय सी ऑर्थोपेडिस्ट. बट हाऊ मेनी पीपल फील दॅट की मी डिप्रेस्ड आहे, आय शुड मीट अ सायकॅट्रिस्ट और सायकॉलॉजिस्ट इमिजिएटली. As a
Quite a sizable number, yes, and
Yes.
I think that's a sign of change.
change, yeah.
It wasn't like that, trust me.
Yes, correct. So it wasn't like that, and that comes with the awareness. When we started, manje, when the sir started is much before that, but when I started,
Not that old.
I'm not saying sir, but when I started in 2008 as a psychologist किंवा clinical psychology masters I am doing, they said की वेड्यांचं सोबत काम करायचं आहे का तुला? देन अभी भी वैसे ही बोलते हैं लोग अभी, फ्रैंकली स्पीकिंग कि तुम्हारे मेंटल में केमिकल में कुछ तो गड़बड़ है शायद, इसीलिए तुम्हें वैसे लोग पसंद है और काम करने के बाद वो वैसा ही स्टार्ट हो जाता है. But still, what I mean to say this kind of statement or sentences, the awareness and the stigmatization about the psychology role or psychology ka P. P stand from physics, I guess. And the people love from the science ki P stand from physics, P stand for physical appearance, but P, when it stand for psychology, it's become stigma. Ki I should not visit psychiatry, I should not see a psychologist, and it's like, कुणाला सांगू नका बरं का मॅडम, मी तुम्हाला भेटलो होतो. या वेन आय सी इन OPD की लोक स्कार्फ बांधून येतात, लोक मास्क बांधून, पॅन्डेमिकमध्ये इट्स व्हेरी हेल्पफुल मास्क वापरण्याची सुटका होती लोकांना. सो फेस दिसत नव्हता, मग त्याच्यानंतर दे यूज अ स्कार्फ. नाव द फेस दिसावं लागतं. दे फर्स्ट आस्क, मॅम द सेशन इज कॅमेरा रेकॉर्डेड, दॅट इज फॉर द सेफ्टी. बट आय गेस त्याच्यामुळे I guess.
Yeah, so the role of us professionals is basically promoting awareness, reducing stigma, and providing that support that an individual needs. So, हे करणारी लोक आपण सगळेच आहोत. पण just because I'm sitting here, I'll tell you what. Okay, so first let's go into basics. Is आमचे क्वालिफिकेशन्स काय असतात ॲज सायकॅट्रिस्ट अँड सायकॉलॉजिस्ट?
So what is difference between psychiatrist and psychologist? I can say, I can talk about myself. When you become a clinical psychologist, if you wanted to work in a clinical field, you have to be MPhil in clinical psychology. As per the 2017 Mental Health Act, it was, if you have to do MPhil psychology, then and then only you can work in a clinical population. बट देर आर पेरिफेरल ब्रांचेस एज वेल कि ऐसा नहीं है कि इफ आई एम वर्किंग एज अ क्लिनिकल आई कैनॉट सी नॉन क्लिनिकल. सो देर आर काउंसलिंग साइकोलॉजी, देर आर चाइल्ड साइकोलॉजिस्ट, देर आर academic psychologists. But the basic qualification, as if now at present, you have to do MPhil in clinical psychology, governed by RCI body. Then only you can work with the population with a clinical domain.
आणि वेन इट कम्स टू सायकायट्री बेसिकली सायकायट्रिस्ट आर आणि खूप लोकांना आय एम शुअर ऑल ऑफ यू नो बट मोस्ट ऑफ द क्लायंट्स अबाउट 70% ऑफ द क्लायंट्स डोंट नो that psychiatrists are basically trained as MBBS doctors, and after that we do a post graduation. शेवटी शिकतो आपण सगळं एकसारखंच, त्याच्यामध्ये थोडाफार फरक असेल पण बेसिक इज द सेम. सो sorry I'm saying this, what edge as psychiatrists do we get is because we are trained as basic doctors, MBBS training. We have a more multidisciplinary, in terms of medicine, multidisciplinary approach towards mental health and mental illnesses. कारण as we all know की सगळे जे आजार आहेत ते फक्त मानसिक नसतात. There are lots of medical issues that present as psychiatric problems. I think Alice in Wonderland madhe there is a character called Mad Hatter. So do we know why that Hatter is mad? Simply because in Victorian days, when the profession of hatter is somebody who makes hats, they used to use glue, and sniffing that glue will make you mad. So by default, a lot of hatters were mad. So it came. So if you are not trained to recognize that a medical illness, say like a hypothyroidism, or in olden days, sometimes now as well, syphilis, they can primarily present as a psychiatric illness. And then when we start investigating, we find out that the main cause is something else. So once we are able to treat the medical issue, the psychiatric issue disappears on its own. Yes, we do need some help. So as doctors, it gives us that extra benefit of knowing how the whole body works and what are the various illnesses, disorders, and how they impact mental health. Yeah. So I think the basic difference is what Smita just said and what I just said. But when we explain this to patients, खूपदा त्यांचा नाईव्ह रिस्पॉन्स असतो. अच्छा, म्हणजे तुम्ही औषधं देणार आणि ते देणार नाहीत
आणि तुम्ही फक्त गप्पा मारणार.
येस,
ॲडेड विथ दॅट.
पण त्याच्यावर खूप काम करावं लागतं की ॲज अ सायकायट्रिस्ट युझिंग मेडिकेशन, आणि दॅट इज माय फिलॉसॉफी, इज युझिंग मेडिकेशन इज ऑलवेज द लास्ट रिसॉर्ट. अँड वेन आय से द लास्ट रिसॉर्ट, डोंट मिसअंडरस्टँड मी. खूपदा आपण असं म्हणतो ना की आता काही होत नाहीये तर ते करून बघू. म्हणजे मी लोकांना सांगतो की पर्याय नसेल तरच मी औषधं देतो. त्याच्यानंतरचा प्रश्न लगेच असतो, अच्छा म्हणजे आमचं इतकं सिरियस आहे का?
नाही म्हणजे तुम्ही औषधं देत नाही का असं पण आहे सर.
आणि आमचा आजार इतका सिरियस आहे का की बाकी काहीच पर्याय नाहीये. तेव्हा त्यांना सांगायला लागतं की इट्स नॉट ओनली मेडिकेशन दॅट वी नीड हिअर, देर आर लॉट्स ऑफ अदर थिंग्स टू. सो as psychiatrists, we tend to have a more holistic in terms of medical background asल्यामुळे we can have a more holistic approach. So that's the basic difference between a psychiatrist and a psychologist who are in the field.
Yes. So basically we can say that psychiatrists can give medicine and mental health. They can treat, they can counsel, they can do psychotherapies who are trained in that thing. Yes. But as a psychologist, we can only practice with the mental health with the terms of psychotherapies. And the next we can share about testing and all we can talk about in next question.
Yes. So as psychologists and psychiatrists, what we do is we promote positive mental health. I'm not saying that we treat patients. That comes last. most important, but that comes last. We promote positive mental health. We equip people to have a more resilient mindset, maintaining their emotional and social well-being, and most importantly, in the current era, is help people have healthy social relationships, because all these are going to lead to a positive mental health which is free from mental illnesses which will impact your life. So that is the main role I see of psychiatrist and psychologist per se.
Yes. As a psychologist, we can provide therapies. As you know, we can provide cognitive behavior therapies, behavior for the depression, for the disorder kind of thing. Behavior modification, it's mainly basically principle on behavior therapy techniques. So behavior modification works with children's, with adults as well, who are not cognitively that much have insight ki I have some problems. So simply we work with BT, behavior techniques, and the rehabilitation, the de-addiction center required a rehabilitation counseling. So that kind of thing. And the couples therapy already sir has said. So group therapy also is a main domain of psychology. Ki, if there are multiple people, matlab, SA was the one of the oldest organizations, if you are aware about it, schizophrenia awareness, social awareness thing. So a basic ideal example of group therapy. If we started with the group therapy is a main domain of not only a psychologist, social worker, a social psychologist. Why group therapy is also important? Because I can me kunashi tari I can see the familiar person who are suffering with the same disorder, and that can empower my self-esteem, and I feel yes, I am not alone in the journey.
I'm not the only one feeling.
Yes, I'm not the only one, and that can empower, and that can be more functioning to the personality. So group therapy is also the things. Then pain management also have a role of psychology. The people who are dealing with cancer, the people who are dealing with we can say CKD, chronic kidney diseases, neuropsychological diseases, RTA. So pain management is the main thing. Then neuropsychological rehab, the people who have a road traffic accident, stroke and all. So the skill it was already learned, and abhi wo nahi hai. So basic cheezein we need to retrain, that is called the cognitive rehabilitation. So, and there are the aim of the psychology is to distress and promote the psychological well-being. So,
Well-being, yes, yeah. So how do we promote this psychological well-being? Again, any ideas? Yeah.
yes. You are not audible.
How do psychologists learn enough pharmacology to understand how medicines affect their patients?
Yeah, that's what I told. Ki MPhil is required, and MPhil there is a skill training program. MPhil they have a pharmacological paper, and in that you can learn a pharmac, what sirs or psychiatrist has prescribed. So basically physiology, human body physiology you need to understand, and then you can learn how the pharmacology work on the physical body. So.
Is there any scope for only psychologists who are not pursuing or
MPhil?
yeah, because
I guess sir will answer.
I think when I was working with KEM, we did have a batch of psychology students who would attend our OPD just to learn the psychopharmacology. It was an individual decision of one of the professors working with that institute. And overall, the feedback we got was amazing. So what I would suggest is you or people like you are interested, pester us. Come and tell us that this is what you need, and I'm sure we'll be more than happy to will be more than happy to accommodate.
Yeah, and exactly the basic idea we have that 3 months ka internship program, 3 months, 1 month of the college. It's basic idea about to learn the pharmacology, to understand basic what are kind of treatment we are giving. यही होता है कि college are promoting to go into the field, see how the psychiatrist or psychologist has worked, what is the basic protocol they are following. So to get that overview of the practical work, I guess.
Thank you.
Yeah.
हेलो आप दोनों से मुझे दो सवाल है. पहला सवाल, व्हाट इज़ द डिफरेंस बिटवीन अ साइकेट्रिक सोशल वर्कर एंड अ क्लिनिकल साइकोलॉजिस्ट. और दूसरा सवाल ये है कि यूनिवर्सिटी ग्रांट कमीशन ने एमफिल को ख़त्म करने का फैसला किया है. इस पे आप लोग क्या सोचते हैं और इस पे क्या करना चाहिए?
I think it's a question for you, Smita. So.
Yeah. Psychiatry, social worker, and clinical psychology. Basically, psychiatry, social worker work in a psychosocial aspect of the patient. And the clinical psychologist work in a psycho-emotional in terms of personality, how he feels, how emotionally he has to go toward the further steps of the life. So that is a clinical psychologist role, and social worker more support in terms of at present moment, social support, family background, and psychologist main role is how the person feel, उसे कैसा लग रहा है, how he can deal with that distress, and how he can empower with whatever skill he have, and उसके आगे how उस skill के ऊपर that coping, how we can develop and how we can go send into the mainstream. I guess that was the answer. And talking about the second question, RCI question. In 28 December, the UGC has given, I'm not an authorized person to talk about this, but yes, I have some information which I'm just sharing. 28 December, UGC has published the notice, MPhil was, मतलब MPhil course was, उन्होंने बंद कर दिया है. But MPhil course runs under the RCI, Rehab Council of India, and there is a committee. There is a Niti Aayog committee. Niti Aayog committee has given a report. 8 years MPhil will be carry forward, because BA का बच्चा अगर MPhil तक मतलब the people who are doing BA first year, second year, third year, or in first MA first year and second year, they will not complete, they will not reach to the MPhil. So they want a buffer till 8 year, and after 8 year only, the MPhil program will stop.
Will be
The information I
derecognized.
guess, yeah.
Right.
So, but still, I'm
sorry,
not the
before-
authorized person, huh?
Yeah, before I take your question, I'll come to you there. I think we'll come back to what we were talking about is mental health. So how do we become healthy, mentally healthy? Again, there is no rocket science. Every one of you, and I'm 100% sure that every one of you has heard this from your parents. वेळेवर उठा, वेळच्या वेळेला झोपायचं, रेग्युलर व्यायाम करायचा,
So discipline,
रेग्युलर
discipline, you are meant to say that?
येस या जेवण व्यवस्थित करायचं, लक्ष देऊन तुम्ही जे काय करताय ते करा, माइंडफुलनेस. You don't need experts to tell you how to be mentally healthy. Our family system has already been teaching us that. I'll just add one more thing is, stay away from social media as much as you can if it is affecting you. Because I know it's impossible to live away from social media. But if it's affecting you, the new word I learned yesterday, doomsday scrolling. If that's happening, you definitely need to be away. So basically being mentally healthy, be mindful, be aware of what your shortcomings are and how you can overcome them. Have a good enough structure to your day. कधीतरी वीकेंडला पार्टी झाली, 4 वाजता झोपलो, हरकत नाही. पण 4 महिने तेच चाललंय तर काहीतरी गणतंय नक्की. ते नक्की नाही व्हायला पाहिजे. सो मेंटल हेल्थ चांगली मिळवण्यासाठी फार कष्ट करायला नाही लागत. छोट्या छोट्या गोष्टी, स्मॉल गोल्स, स्मॉल अचिवेबल गोल्स टुवर्ड्स बीइंग physically and mentally healthy. Moving on to the next goal once you have achieved your previous goal. And at any point, if you feel that things are not going great, shout out for help. That help, mind you, does not have to be from us. Well, all of you are psychologists, most of us. So it does not have to be from professionals. The help that you can ask for can be from anyone. Your parents, your partner, your friends. In fact, there was a study in community psychiatry a few years ago, and Dr. Mohan Agashe is also a very great proponent of this. पूर्वी खेड्यांमध्ये झाडाखाली पार असायचा आणि लोक सकाळ संध्याकाळ पारावर गप्पा मारायला जमायचे. That was the best psychotherapeutic group setting one can experience. किंवा त्याचंच एक्सटेन्शन असं आहे, आणि येस त्याच्यामध्ये थोडा इट रिफ्लेक्ट्स बॅड ऑन सायकॅट्रिस्ट. सायकियाट्रिस्टकडे गेल्यावर वेटिंग रूममध्ये जे 3-4 तास बसायला लागतं त्याच्यातच बरेचसे आजार कमी होतात आणि खूप उत्तरं मिळतात.
Everybody is
उशीर
asking.
व्हायला नाही पाहिजे, पण जो होतो त्याचा काहीतरी उपयोग होतो असं दिसलंय. सो सीकिंग हेल्प, इट डझंट हॅव टू बी फ्रॉम द प्रोफेशनल्स, बट वी नीड टू बी माइंडफुल दॅट वेन वी आर इन द wrong word maybe, but business of providing help, if there are any limitations to what we can do, एवढं आपल्याला कळायला पाहिजे किंवा मोठेपणा पाहिजे की हे मला जमत नाहीये, आता स्मिताकडे जा, किंवा ये मेरे बस की बात नाही, आपण नातू मॅडमना जाऊन भेटूया. सो यू नीड टू नो what are your limitations are, what all things you can do, and how and when you should refer. Like आमच्या सर्जरी ट्रेनिंगमध्ये there was, well, he is no more now, there was a great surgeon called Dr. Sane. His favorite line was, a good surgeon knows when not to operate. त्या याच्यावर मी म्हणेन, a good professional knows when I am failing into something and I need to pass it on. It doesn't have to be an ego issue. जमत कसं नाही मला, अरे नाही येत आहे तुला, पाठव ना कोणाकडे तरी, पेशंटचं कशाला जाऊ दे. So we need to know what our limitations are and what we can do with the knowledge that we have. Because आपल्याला कितीही वाटत असलं आपण खूप हुशार आहोत, ट्रस्ट मी नसतो. आपल्याला न येणाऱ्या खूप गोष्टी असतात, त्या समजून घेऊन पुढे जाणं हे जास्ती महत्वाचं आहे. पण बिफोर आय कम टू यू, आय थिंक देयर वॉज अ क्वेश्चन देअर. या
Hi, so my question was to spread awareness. First, we need to let people know that there is a problem, and people don't accept there is a problem, especially in a lower middle class. They're like, लगा है हल्दी लगा लो ख़त्म करो. They won't be like, कशाला जायचं है, डॉक्टर को क्यों पैसे देने हैं जब घर पे ठीक हो रहा है. तो जब वो लोग एक्सेप्ट ही नहीं करते हैं कि there is something wrong, they are not handling their stress well and they need help. How can we spread awareness when they are not understanding there is a problem?
I think that still remains a very big challenge, because again, when we heard about the intersectionality, problem for you and me may not be a problem for someone else. When we sit in our private practice, when I work with young kids, I have seen many kids who were extremely distressed, anxious and depressed, syndromally and clinically, just because they could not go back to their original school, which was either in US or in Europe. हा प्रॉब्लेम ज्यांना शाळेलाच जायला, सॉरी दॅट्स माय हाफ एन आवर टायमर, हा प्रॉब्लेम ज्यांना शाळेलाच जायला मिळत नाही त्यांच्यासाठी एक्झिस्टंटच नसतो. So I think what we need to do is have a very good dialogue with our clients and the awareness part. की प्रॉब्लेम आहे म्हणजे वेड लागलाय असं नाहीये. You don't have to be mad to come to psychiatrist. Even if, or psychologist, or seeking professional help, if there is something which you feel is not yourself, I would call that as a problem. And for that problem, there are many avenues available. As I said, go to your friends, go to the neighbor next door and have a chat with them. But that remains a very big challenge in our practice, yes. Yeah.
I have
Sorry,
another
can I
question.
just move to someone else? I'll come back to you
Yeah,
later.
sure.
Yeah.
So I had a question that if what can be like the specific indicators because of which a psychologist would refer a specific client to a psychiatrist?
You mean to say psychiatrist referred, which kind of client we are getting from psychiatrist?
No, what she means is,
So, like-
when should a psychologist refer a client to a psychiatrist?
Psychiatrist. Some
Okay.
specific indicators that a psychologist observes. in a
Yes. So basically, when in my practice, I see pediatric to geriatric client. So when I feel that there is a need of medication, matlab I started with, I take the case, I understand what is the problem, I'm giving them a solution. There are 2 sessions, but I don't see the progress, what exactly I wanted to be. So then that is my limitation, ki there is something I'm missing. There is medication role, and meditation has to be prescribed by psychiatrist, and that is my role, that is a psychologist role itself, ki medicine compliance, ki भाई अब तक हम लोगों ने सब कुछ करके देखा. We have done, we understand your needs, we are discuss, we are giving the behavior modification or cognitive restructuring, but still the things are not working, it's the same. So we required something added, and that could be a magical component as a psychiatrist medicine. I say magical because when I say psychiatrist medicine घ्यावे लागतील, मग पेशंट म्हणतात नको नको मॅडम मेडिसिन नका पाठवू, मेडिसिन सोडून तुम्ही बोलत राहा. So I know where is my limitation. I'm not forcing them, but empowering them to take medicine for their betterment. That is also my role, I guess.
Yeah.
डिमांडमध्ये आहे and pop psychology, like the one
Insta किंवा मग
Okay.
reels वरती it's like psychology says.
Okay.
So how is it? I mean,
Sorry, that shows my age again, but I'll read that today.
So
Sorry.
for like in medical setting also की लोक जाऊन गुगलवरती सर्च करतात आणि ते असे म्हणतात की आय थिंक आम्ही ह्याच्याने डायग्नोस्ड आहोत.
Yeah.
आणि तसंच आय वुड लाईक टू नो युअर ओपिनियन की इवन सायकोलॉजीच्या फील्डमध्ये वेन पीपल रीड अबाउट थिंग्स दे लाईक की हां मला झालं आहे डिप्रेशन, इट इज नॉर्मलाइज्ड. सो वॉट इज युअर टेक ऑन दॅट?
Personally, what I think is, in my own clinical practice, I don't depend on diagnosis. Diagnosis has a very limited role. Diagnosis has a role only for research and communicating with colleagues. So rather than me giving you a 3-page history of a patient, if I was to tell you, ki, look boss, I think she has a moderate depression, I think you will have a mental image of that person. Will you understand the person? No. So diagnosis itself in the clinical practice has very limited role. Personally, I don't diagnose anyone. I don't diagnose with disorders. I don't work with disorders. I don't work with diagnosis. I work with people and their distress. And when that happens, sorry, it's not a populist statement, but this is how it is. Because, as you correctly said, आणि आताची नवीन फॅड असं आहे की खूपशा ॲडल्ट्सना असं वाटतंय की त्यांना ADHD आहे. सो people come with a ready-made diagnosis with a printout from some
Testing.
fancy American website for which they have paid about $800. That's the cheapest. And they tell you, मला ADHD आहे आणि हे औषध अमेरिकेत मिळतं रिटेलिन, मला त्याचं प्रिस्क्रिप्शन हवं आहे. So my first and also it comes to, as you said, की मला डिप्रेशन झालंय, मला औषध हवं आहे. So I tell people that औषध मी देईन कदाचित, पण आधी मला डिप्रेशन म्हणजे काय हे सांग. Forget the word depression. तुला होतंय काय हे आपण बघू. Tell me your symptoms, tell me why they are coming. Then we'll decide whether it's depression. If we agree on something, then we'll decide whether you need professional help. लागणारही नसेल कदाचित. 4 दिवस झाले, बायकोशी भांडण झालंय म्हणून मला डिप्रेशन आलंय. घरी जा, कॉफीला घेऊन जा, छान गप्पा मार, डिप्रेशन जाईल 2 तासात. पण well, the good sign of that is there is awareness. People, even though it's a wrong trend, people are diagnosing themselves with the help of Google Doctor. So there is awareness, so you can capitalize on that. So what I usually do, I praise them that yes, चांगली गोष्ट आहे, तू इथं आलायस, तुला डिप्रेशन झालंय असं वाटतंय, पण आपण एकदा तपासून बघू हे नक्की तेच आहे का, आणि मग ठरवूया. कारण if you ridicule a patient, they are not going to come to you, they are not going to go to another therapist, and they would land up someplace which may do more harm than good. So taking them on board, understanding them, and then guiding them through the journey is more important. So
Exactly.
तू काय सांगणार?
हाँ, I just wanted to add कि if that person is coming to you and selling self diagnosis की मला depression आहे, मला ADHD आहे, मी हे सगळं टेस्ट घेऊन आलोय, accept what the person is saying. If you decline, then you are rejecting the person as it is. So your role as a psychologist, just listen, try to understand what they are meaning to say, and rather than going to the diagnosis, try to help them out in a simple way, as sir said.
Yeah. I think we'll take one last, sorry, there's someone else there. Can we take a last question, last row, second last row? Yeah. And then I'm going to sum up because I think I'm already 2 minutes over time, so.
So, earlier she asked about the psychology says this. So currently, because 24/7 facilities are not available in psychology and counseling, there are a lot of AI, like AI is taking over everything now. So AI chatbot has come up where we can actually have a conversation with the AI, but it is just not a human. It is like accessible anytime. So how much do you think, because it has pros and cons both the sides, how much do you think we should let AI also interfere in the field of psychology?
AI in the interfere of psychology.
My first response to this is help. If somebody knows what's happening, what the role of AI actually is, frankly, I'm not an expert. I don't know. But being a human being, being a non-machine, what I would say is you cannot, and as you correctly said, you cannot rule out a human face to it. As it stands today, I'm a very big sci-fi fan. I'm a big fan of Arthur C. Clarke and Asimov. So there will be a day in 10 years, 15 years, 50 years when we won't need people like us. And that would be a welcome day because that will free us from doing what we are doing and into doing things that we like. But till then, all these algorithms are well developed with an element of empathy and emotionality. I think you can't replace a human touch, a human being. But I don't want to write off AI at all because the way it's moving, and especially if you have been following the latest tech news, there was a very famous sacking and re-employment of a particular CEO, no names. The rumor is that his particular model had developed conscience. Scary thought. They vehemently deny it. I won't be surprised if they declare it after 10 years that we did it. But till then, I think we as professionals are safe.
Thank you.
Yeah. So what I basically want to say is, I'm going to wind up now. We can take questions later, but what I basically want to say is mental health is not too difficult. Achieving mental health is doable for everyone. If you follow a good lifestyle, engage into activities that you enjoy, set up realistic goals. मी कितीही ठरवलं मला नातू मॅडम सारखं मोठं अकॅडेमिशियन व्हायचंय, शक्य नाही. माझं मला कळलं की आय एम केपेबल ऑफ डुईंग ओनली दिस. What's important is whatever I am good at, I need to be the best. So accept what you are, enjoy your life, set realistic goals. Most importantly, and I'm going to end on this note, is having a very good support system. May it be professional or a group of good friends is most important in achieving positive mental health. What I've not done today, or we've not done today, is deliberately touched upon signs, symptoms, disorders, diseases. सगळ्या पुस्तकातनं दिलेलं असतं, सगळेजण ते शिकवतात आणि ते सगळ्यांना येतच. म्हणजे परीक्षेमध्ये आमच्या एक्झामला आमचे टिपिकल गाईड टीचर होते. कुठल्याही कॅन्डिडेटला आधी ते विचारायचे की मग मला सांग, आता तू सायकॅट्री 3 वर्ष अभ्यास केलास ना, तुला काय काय येतं. हे म्हणजे कार्यालयात दिवे बंद होतात तसं झालंय, पण माझं संपतच आहे. तुला काय काय येतं, आणि वन्स यू टेल देम की आय हॅव स्टडीड ऑल दिस, ही विल नॉट आस्क यू अ सिंगल क्वेश्चन बेस्ड ऑन दॅट. He will ask me questions about what I don't know, because he used to say that when you answer a question to which you have no answer, we know how good you are. So जे आपल्याला येत नाही त्याच्यावरती जास्ती काम करणं. So signs, symptoms, diseases, disorders, औषधं, serotonin, chemical लोचा, we all know that. What's important is how to be healthy. कारण again, prevention is better than cure. And I'll just wind up by saying this, is 2002 साली जेव्हा दीनानाथ हॉस्पिटलचं उद्घाटन झालं तेव्हा अटल बिहारी वाजपेयी आले होते त्याला. तर वाजपेयीजी त्याला म्हणले होते की ये आमच्या भाषणात म्हणले होते की बेसिकली व्हॉट ही सेड इज आय एम इन अ बिग फिक्स. बिकॉज इट्स अ हॉस्पिटल, आय कांट से दॅट यू प्रॉस्पर, बिकॉज आय डोंट वॉन्ट पीपल टू गेट इल. But whatever you are doing, do it to the best of your capacity. So if we aim for positive mental health, there'll be less work for us. That's what we want. But when there are cases, I think we need to do our best to help them. Right? So thank you. Thank you very much.
So much. I think we reflected on core concepts. And we really looked at, looking at experience labeled as MAD. Thank you so much for helping us. That I invite Dr. Rupa from MCF to felicitate Smita Karve ma'am and Dr. Panchanadikar.